Changes are coming to the Centers for Disease Control and Prevention.
The CDC is actually calling it a reset and admits its public guidance during the coronavirus pandemic was confusing and overwhelming. The reorganization of the agency comes amid growing public concern over two other diseases, monkeypox and polio.
Joining us this morning, CDC Director Dr. Rochelle Walensky. Nice to have you back on Good Day New York.
Always good to be with you. Thanks for having me.
So, Dr. Walensky, I know you talked about regrets and mistakes in the past with COVID-19. Monkeypox going on. As you know, New York, the center of it all. It seems like there's a real sluggish response going on here. Have you been able to correct whatever mistakes you made on COVID-19 to get up to speed with monkeypox?
Yeah, well, maybe I'll just first address the announcement that we made this week. Look, this is an agency that has a long 75-year history and deep expertise within the agency, and we've been preparing for a public health challenge like COVID-19. And when it came to us this past several years, we didn't reliably meet expectations, and we need to acknowledge that. I have been a champion of public health. I've been an admirer of the CDC, and I want to lead the agency to a place, and truly the country, to a place in public health that is improved. And that means, in my mind, emphasizing areas like accountability, emphasizing our deep public health partnerships across the country with our local and state jurisdictions, emphasizing timeliness of how we get information out to the American people, and emphasizing communication and how quickly we get that communication, not just in scientific language, but in language that the American people can understand. When it comes to monkeypox, we are actively addressing the challenges both that continue with COVID-19, but as well with monkeypox.
So I'm just concerned because, in the beginning when we heard about monkeypox, we hear it was strictly basically in the gay male community, mostly. But now we're hearing animals getting it. I heard a woman got it. I mean, do we know everything we should know about monkeypox right now, or is that still developing?
That's a really important question. We are standing on the shoulders of decades of research and experience and understanding monkeypox in other countries. But it is also the case that this outbreak is different. And it's also the case that many people in this country, most clinicians in this country, most people in this country have never heard of this infection and never heard of this disease. So we've been doing a lot of education, a lot of communication with both our clinical partners as well as the community most affected. And we still have more to learn about this infection as it pertains to this specific outbreak.
Should heterosexuals be concerned is what I'm asking you, because right now we've heard it was basically the gay community. Is it more than just the gay community?
Well, here's what we know. We know that this infection is transmitted with close skin-to-skin contact that often occurs during sex. Most of the people who are getting this infection, about 93%, have engaged in, are men who have engaged in another sexual activity with another man. But it's not just limited to that population, and it really can spread to other populations, as you've started to see in rare occurrences.
I want to go back to some of the things that you talked about in this, report. You said that, you want to have more collaboration. So take us back to, the height of COVID. You had a lot of opposition, people on the other side that maybe thought differently than the CDC, that were completely shut down. Do you think moving forward, whether something happens like this, you may take into account other people's opinions? I mean, for example, I know when people took the vaccine, there was issues with menstrual cycles and it was completely shut down. You were not allowed to talk about that. Obviously now we see some different things. So maybe would you be open to differing opinions moving forward from people, from scientific experts?
We absolutely are open to those opinions. I do want to be very clear that we develop these guidances based in the latest science, that sometimes, as was the case with COVID, that science is ongoing and that science is developing. And what I'm committed to is communicating what we know and what we don't know and engaging in those conversations. In these collaborations that we're talking about, these are deep collaborations with our local public health jurisdictions. They're the people on the front lines doing the hard work on the ground, as well as our state public health partners, but also our local epidemiologists, our local laboratory partners, and then really want to think about how we can engage more deeply with new innovative partners, either through academia or through industry.
Let's talk about polio, because I've been seeing some stuff on social media where people are posting, don't drink the tap water in New York. I know polio was found in the wastewater, but how directly connected is that? Is there a chance that we could see polio get into the tap water here?
Here's the most important thing I think for New Yorkers to know about polio. We have detected polio. There was, of course, this case of paralytic polio in Rockland County. We've detected in other areas of that county, in Orange County, and now in New York City. What I want to say very clearly is if you have received your 4 doses of polio vaccine as a child, or even if you've gotten them as an adult, if you're up to date on your polio vaccine, you're protected from paralytic polio. We have decades of experience now that demonstrate that protection is long lasting, over 99%. So the most important thing I think one can do right now, if they're concerned about polio, is make sure they and their loved ones are fully up to date on their polio vaccines.
But can we see it in the tap water? I think that's just a concern that people might have in general.
When we see how polio is transmitted, as we call, from the fecal-oral route, but that can come from contaminated surfaces. It can come from contaminated water. And so the real important thing for prevention of polio is to get yourself vaccinated.
So I'm wondering, how closely do you work with like the New York City Health Department? Because, there are reports today of still racial disparities in getting vaccines out, whether it's monkeypox or COVID. I don't know who you point the finger at, but I mean, why is that still going on?
Yeah, so first of all, let me say we work hand in glove with our local and state public health departments. When we and that is true for COVID, it's been true for monkeypox, it is also true for polio. When we work with these local health departments, what we do is we allocate vaccination to the local health departments, and we work in collaboration in communications and many other things with regard to sending that, getting vaccination out, getting messaging out. We do leave it to local jurisdictions as to how and where they will send that vaccine, but we also work hard with them to try and have equitable allocation, equitable distribution, and administration. We're starting to see the data now, as has been noted before. We didn't have access to all the administration.
Oh boy, she froze. Will we get her back?
Might get some audio issues. Maybe we'll get her back another time.
We got her back? Okay, we got her back. Dr. Walensky, you froze a little bit there with technology.
Oh, I'm sorry.
Let me ask you a little bit about school, because we're just a few weeks away from school, kids going back. What should parents know? What should they do? How are COVID protocols different than last year?
First and foremost, we want our kids back in school to have an exceptional school year ahead, really energetic school year ahead. Most important thing you can do, make sure your child is vaccinated. That will prevent your child from getting severe disease should they get infected. If they have symptoms, you want to keep them home, you want to get them tested. We are working hard with school systems to get ventilation in those schools so that they have more protection in that way. You can always go to cdc.gov, find your community level, your COVID-19 community level. If you have a high community level, we would recommend you and your child wear a mask. And also mask if you're exposed. So we have a lot of things that we're doing now this year, but first and foremost, one of the things you can do, get your child vaccinated.
All right, well, listen, good luck, because I know you're kind of reorganizing the CDC, and the bureaucracy must be incredible. Are you walking around with like knee pads, punching bags? Like, what are you doing to like do this?
I have an incredible agency, and we're all in this together, and I can't emphasize enough how much I'm looking forward to getting our sleeves rolled up and doing the hard work.
All right, good luck. Dr. Rochelle Walensky from the CDC, we appreciate you coming on Good Day. Thank you.